You're listening to the Sisterhood of Limitless Living podcast. I'm your host, Dr. April Moreno. I'm a public health specialist focused on integrative wellness and autoimmune living, supporting the community of women, where I help you to live your best quality of life through being your best self-advocate. Let's get started. Hello and welcome to episode number 71 of the Sisterhood of Limitless Living podcast. I'm your host, Dr. April Moreno, and hope you don't mind. We've got a panting dog in the background. Our co-host, Wellington, was out running around with his new sister, his little sister, Bernadette, and he is exhausted, and now he's heavy breathing in the background of my podcast. I hope you don't mind and hope you can't hear it, but that is the reality of working from home. So today I'm actually going to be sharing with you a past recording I've done. This is about a year old. This was done for my Sisterhood of Limitless Living Facebook group. And I want to share it with you today because of how important it is and how timely it actually is as it relates to the pandemic. This recording was done way back before the pandemic was even a word, before people even knew what a pandemic was. And it was, about a year ago, where I was talking about an article that I saw in the Journal of the American Medical Association on information and misinformation. So I talked about this article in what I called a series of article breakdown, where I talked about in detail, just breaking it down, what this article publication was saying and how to apply it to the autoimmune community. So I hope you enjoy this episode where I talk about medical information in the literature, in research, and how you can access this information for yourself that is publicly available. This is government-funded research for the most part on PubMed, and how you can identify what information is out there, what misinformation is out there, and also where the missing information is, because there's a whole lot of missing information as well. So I hope you enjoy this episode. I'm Dr. April Moreno, and here to do an article breakdown. Welcome to another episode of Limitless Living Article Breakdown. So today we're talking about a recent article on counteracting health misinformation. This is from the Journal of the American Medical Association, JAMA. And it's a very recent article, a couple of days ago. It came out, and it's available online. It's free to the public. If you try to download the PDF, you'll probably get a paywall, but at this time you can just go directly onto their website and you can read some articles that are out there in recent publication, which is pretty cool, right? And so this one is about counteracting health misinformation, a role for medical journals. And I wanted to do this article breakdown today to talk about what medical misinformation is and isn't, what medical missing information is as well, and then also how we can discern for ourselves, determine what this information and misinformation and missing information looks like as it relates to our own self-efficacy, our own advocacy for our health. And so let's go into this. So this one talks a lot about popular fallacies about health and illness. Their concern is about outbreaks of measles and other communicable infectious diseases, right? So medical misinformation defined by these two authors. Let me go ahead and break down a bit here. So Paul Armstrong and David Naylor are from Canada. They're from universities of Alberta and Toronto. And they define medical misinformation as a health-related claim of fact that is currently false due to a lack of scientific evidence. Okay, and that's a generous interpretation. I guess I could click on this to find out where they're getting that definition from. It's from this article here. Okay, tracking down citations is really important as we try to identify what information and misinformation looks like. So we want to be able to identify the source of these things. I guess before I get into this, I don't really do this often, but really for me, the references are like one of my favorite parts of an article, because this tells us really the bones of where they're getting their information from, that they're adding upon, right? So references are wonderful. I love them because this tells us exactly where we can go for more information, where they're getting their information from, and then what they're adding on to, okay? So finding the source of things is really important as we try to track down what information and misinformation is about. So this here is kind of problematic, in my opinion. Just because something is not part of scientific evidence doesn't mean that it's currently false. You can think of that in terms of like the AARDA, the Autoimmune Association, right? The American Autoimmune Related Disease Association. They found that there are over 100 different autoimmune diseases out there, and they found that there are like 50 million people around the world who live with autoimmune disease, where according to scientific epidemiological research, there would only be 25, right? So we're seeing these gaps in the literature, and that's something that drives research. Most of the time when we're writing articles and we're publishing, it is because we're stating and identifying a gap in the literature. So scientific evidence is one thing, but saying that you have to prove it before it's not going to be identified as currently false. That is something else. Kind of a deficit mentality, right? But anyways, I get where they're trying to go with this article and how important it is about counteracting misinformation and identifying what information looks like. Okay, so yeah, we see in complementary alternative medical approaches that there may be missing evidentiary bases, right? And this has continued to persist over time. So no matter what, whenever we find scientific proof of something, we are going to continue to work with alternative ways of healing. And we all do it, there are established MDs out there, established PhDs out there who have also done it. There are gaps in the literature. And I guess we'll go into that a bit more later. What is missing in the literature? What is missing in the literature is actually the driver of research. It actually drives innovation. It actually drives science. Okay, so they're talking about the concern about multiple digital sources, about their new frontiers of information without oversight or curation. So nearly anything can be taken seriously by some consumers. So there are statements that are made all the time in social media, in blog posts, and even in magazines that are not scientifically founded. One example for me was reading Prevention magazine. I found in one issue alone, I found a few different statements in there that are like, whoa, hold on a second. Where are you getting that source? Why are you saying this? What is your logic behind making this statement? The one that was most concerning to me was where they were talking about intermittent fasting being ineffective. And this was from a few months ago in Prevention magazine. It was just a statement that was just thrown out there in an article with no citation, no study, no results. And to me, that was very, that gave me like definitely pause, because it was just like, I know that these studies are still being done. We are still conducting studies on the effectiveness of intermittent fasting. And it was definitely a form of misinformation to have a statement thrown out there in Prevention magazine saying that it's not effective. At least give me a source. At least tell me where you're getting that information. You will find in the science, in literature, you will find conflicting information. Definitely. I just want to know how you're coming to this conclusion. Where are you getting this information from? To me, that helps me understand whether something is information or misinformation. I need to know the source. So that's why bibliographies are super important. References are super important to help us along the way. You will find that there's a rabbit hole sometimes of references. Sometimes when you're reading an article, you're reading someone's dissertation, you're like clicking through, you're trying to find the source of some information that they've stated. This is really juicy information, but then I'll try and click on the source, And then it'll click to another source saying, well, this person said this and it came from here, and I'll click on that and then it came from here, and I'll never get to the actual source. This happens every so often. But anyways, going back. Okay, so this is a concern. The role of medical journals often being limited, inaccessible to lay people, right? But we are seeing that there are some new efforts to make information more accessible and available. For example, this article itself, I haven't gone and logged in. I haven't tried to do that through my university sources or anything. This is available online to the public and free. Okay, if I try and click here, I'll get a paywall, right? But right now, this is available to the public. So that's one way we can make science and scientific information available to the public. Okay, so here is a table of specific actions that medical journals, such as the American Medical Association's journal, JAMA, could take to counteract medical misinformation. So they come up with 4 categories of strategies, like containing the dissemination, the way that information is spread, general immunity through science literacy. This is pretty cool. This is like basically training individuals to develop critical thinking tools, critical thinking skills, to question information that's out there. That's really important, and I know I didn't have that in primary school, most definitely not even in secondary school. I didn't learn how to think critically until I was in college, to start to question things like, where is this information coming from? Who does it serve? Why do you think they wrote this? How did they test this? Does this include my perspective, or do I still agree or disagree with this, and why? So there are some really important questions. There are many more. So like positionality, where's this person coming from? What is their perspective? How are they writing this? What is the style? Who are they trying to communicate to? Who's their intended audience? So these are all examples of critical thinking, ways of thinking. When we look at literature, we look at science, we look at the way things are written, being able to question the design, the motivation, and the perception, the origin of something is really important. And then how specific inoculation and education, I find it really interesting that they're using a lot of this vaccination language here. So anyways, promoting medical science, communicating common misconceptions with, using social media, town halls, conventional print and broadcast media, preparing the next generation to navigate a world of truthiness and pseudoscience. So article breakdown is my way of contributing to the dissemination of medical information that's out there, or research information that is out there in the literature. So sometimes I will bring in articles that are not available to the public behind a paywall. Sometimes they are available publicly. So this one is one that I found out about on Twitter today. And, it's like, yeah, this is a great one to talk about in article breakdown today. So then, okay, I wanted to talk a bit more about how to discern information and misinformation and what is missing. But even before then, I guess I wanted to talk to you about the reason why they wrote this, right? So one of their concerns was about infectious communicable diseases that are out there, like measles and things like that. And then also GMOs. Trying to find that sentence here. So they had some specific reasons and motivations for writing this, right? Let's see here. Oh gosh. Maybe you can see it. I can't see it right now. It's in here. Oh, anyways. So yeah, they had specific concerns about here. The Zika virus outbreak, vaccinations, water fluoridation, GMOs, or genetically modified foods, and treatments for common diseases. So I can see where they're coming from. From a public health standpoint, the very origin of public health was to control communicable or infectious diseases that were out there in the environment. Tracking down the source of cholera, measles, or other diseases was a really important part of public health. Plagues even, to be able to identify the source of where it's coming from, and then to develop ways to prevent it from continuing to be a public health burden and challenge to the public was the intention behind these vaccinations. And so in the field of like integrative health or in functional medicine, we do have a lively debate about vaccinations, right? And for me, it's not my interest to debate whether or not we need a vaccine for things, but for me, it's like, let's get to the point. We all can ideally agree that measles is something that we should not see increasing in the public. We can all agree that, things that should be preventable should not be, a risk to people with compromised immune systems. If we can find ways to develop cures or protective measures against these infectious conditions, I think we'd all be on the same page, I think. Right. But to me, yeah, these things should not be spreading. These things should not be increasing. Conditions that we have almost eradicated centuries ago or a century ago should not become a growing concern at this time, because we have new and emerging variants of diseases that are out there, different new concerns out there that we need to be focusing on. Okay. And so that is my perspective on vaccinations. Whether or not people support them, that's not something I get into, but to me it's as simple as these should not be public health concerns at this time. And so anyways, so the next part is about how we're going to discern what is information and misinformation. And so again, that is part of this process of like referencing, identifying the source of where people's statements are coming from, or their research, like where are they finding these results, and actually clicking in if possible and actually reading the source of where they're getting their information. So for example, here, PubMed, right? So you can always access pubmed.gov and you can find the abstract of current clinical trial results, articles that are out there. There's a paywall often, but you can at least read the abstract. And the abstract is pretty much your concise, condensed summary of what is going on in the article. So it's your introductory statement, it is your hypothesis, it is your methods, and then often it's like in one or two sentences, it's the results, and then like a conclusion that they've made about the future or the next steps in research. So you'll find all of that on pubmed.gov for free, at least the abstract of what's out there in the science. And you can also use Google Scholar. I love Google Scholar because it gives us so much insight into a variety of publications that are out there. PubMed is useful, but PubMed is only going to include a certain set of articles. You actually have to like submit it to PubMed. You actually have to format it and submit it and present it so that it gets uploaded into PubMed. So I'm in the process of getting one of my articles posted into PubMed, and I hope I'm doing it right. So yeah, it is going to limit what is accessible at this time. But if we're looking at information and misinformation, scientific information is going to be found and available in PubMed.gov, clinical health-related information, article, results, publications. And then Google Scholar is also a broader scope of what's available publicly. And again, for the most part, you can access abstracts, if not full articles. And I do appreciate every so often when we get access to these online free publications. They tend to cost a couple $1,000s to the authors to get uploaded in here. Just so you know, there are often publication fees. Anyways, that's like how the sausage is made. Anyway, so yeah, how to discern information and misinformation. Again, number one, again, clicking on the source. Keep digging back, keep digging in to find out where this information is coming from. And if you can, read as much as possible on the article of interest, this topic of interest, to see how they actually designed the study, who was included in the study. Okay, sometimes you'll find something that was like done in a completely different country, and it was done with a medication that's not even like, accepted in the United States. Like it's not even like given here. So you'll find this whole range of things that's going on. You'll find that they use a certain scale of like effectiveness of a health condition that is not used in the United States, whatever it is, different environment. It could be the NHS versus, what's going on in a different country in the United States. So there are a whole different set of parameters and different contexts in which a scientific study is being done. So that can kind of, distort the way we translate the information here. And we look at comparing the results for our own beliefs, our own conclusions for ourselves, And so discerning information, misinformation. So sometimes you'll look on a blog post and they'll talk about, hey, this new article came out about this new breakthrough discovery about this new drug. And then sometimes that will be the extent of what people are seeing. But I like to dig in a little bit more. Who wrote the study? Who made the study? Who actually were the scientists involved? I'm going to click on their article because usually that blog post is paraphrasing an actual publication from a journal. And so I'll go ahead and try and track it down. So that for me is really useful. One example was with the CDC, and they had done a study about the not effectiveness, but just like the consequences of fluoridation and health. And I don't know if I can track it down right now, but basically it was about the CDC and fluoride, right? Toothpaste. And, there were comments out there that this was a public, a public statement, a public warning not to use fluoride. Okay. And that's not what happened. That was not a public announcement, official warning. This is what they were talking about here. It was an article about toothbrushing and children. And, they talked about like how there are definite, like if you use it in excess amounts, there could be some health concerns, but they did not take it so far to say that there was a public health emergency. In fact, they still recommended that all people drink fluoridated water. So, it's really important to read articles out there, to track down the source of information. So for me, it's like, okay, if we're going to go into like scientific statements about things, at least going into like government sources of information that is useful, or medical sources of information like the American Medical Association. For me, this is, considered publicly acceptable information. And this is where I like to start. This is like my safety net of perspective, because there is misinformation that's out there. There are statements that are made out there in the public that are not founded on anything, okay? But I wanted to say, before I conclude here, what is missing is finding out who's included in these studies. Okay, so there's a lot of information, especially in the autoimmune community, that we have shared with one another about the side effects of medications, or experiences in studies, or experiences with, the symptoms of conditions that are not documented. But we find that there are trends out there. There are definitely things that have emerged in conversation that have not been documented in science. So there's information, there's misinformation, but there's also missing information. So what is missing out there in the literature is more diverse perspectives in science, more diverse individuals in the population that's being included in a clinical trial. We have a limited group of people who tend to participate in clinical trials. We find that people tend to be English speaking, Caucasian, white. They tend to be high income or more highly educated. These are the folks that tend to participate in these clinical trials, and that can actually, misrepresent the whole general public about what is working and what doesn't work in terms of clinical trials and behavioral research. All of that is like, there's so much that's missing still out there as well. And so one effort that's being made right now is the CDC's All of Us program. So I can share that with you. The All of Us research program that's out there at the moment. So that's one effort there with the NIH that they're working on to try to bring in like more diverse perspectives, biosamples into science. So that's one thing that people are doing out there right now, and that's their goal, to continue to build upon the information, the science base of what's going on out there, because it is a problem, and we know that there are people who are not being represented. Okay, so we must gain better insights into the influences of these diseases to make a difference for the millions of people who suffer from these diseases. There's precision medicine, kind of like your N of 1 research, where looking at how we all have different health outcomes based on all these different external factors and internal factors. So these are all ways that we can look at how to build upon the science. It's about building a national research cohort of participants. Anyway, so that's something that the NIH is currently doing to continue to build upon, broaden information, broaden the science, and be more representative of all individuals in the public, in the population. So that is the information I have for you today. So basically, in summary, people can say anything in social media. They can say whatever they want. For me, it's really important to try and find the source. Where are you getting this from? If it's your own personal experience, I respect that completely. And it's a fact that there are experiences out there that are not documented in science. There are trends out there that are not documented in the science. But I just want to know where you're getting this information from. What is the source? Okay. And then I wanted to talk about, it's up to you now to discern based on, what people are saying. Does it make sense to you? You can try, there's no harm in trying that ashwagandha if you so choose to. I mean, I've tried it and I think it's great. But, so what's out there? But then again, there's also like a whole level of like multicultural and holistic approaches to health that have been passed on for generations and thousands of years that are not in Western science either, right? So that's missing information. Again, so it's up to you how you determine what you're going to follow from information that's out there. But today, my goal was just to provide you with information about how to kind of track down the source of what's going on. Again, this was that article where people were saying this was a public health emergency, and that's clearly not what's going on, because they're still recommending fluoride use. First sentence in their discussion, right? So yeah, being able to track things down is really important. So patient experiences are still missing in the literature, like I said. And so places like Facebook groups or online patient-powered research networks are still super important as we try to find out more information about our experiences with medications and side effects of conditions or symptoms that are not always included in the literature. And so that is pretty much article breakdown for today. I hope you enjoyed it. If you are interested in learning more about the autoimmune community, participating, and finding out more about article breakdown, feel free to join our group, the Sisterhood of Limitless Living, on Facebook. Or also you can find out more information about me on aprilmorenophd.com. And have a great day. Thank you for listening to this episode of the Sisterhood of Limitless Living podcast, Season 2. Hope you enjoyed the episode. Look forward to having you join us in upcoming episodes as well, where we continue to talk about integrative wellness and autoimmune living our best lives, being our own best advocates. Feel free to subscribe on iTunes to the podcast, and we are also available on several other locations as well. For more information about Dr. April Moreno, you can visit aprilmorenophd.com. Take care.